ear, nose, and throat last-minute flashcards. An infant with isolated pre-auricular skin tags. Renal ultrasound is not indicated if no other congenital anomalies or risk factors. Very important to know that the risk of permanent hearing impairment in a newborn with isolated pre-auricular skin tags or pits is 5-fold higher compared to the general population. So if this baby passed the neonatal hearing screening, this should be sufficient. Adolescent wrestler with blue swelling and redness in the right ear pinna occurred during a school match. Auricular hematoma. This will require urgent aspiration of the hematoma and pressure dressing. X mark is for left air conduction and more than is for left bone conduction. So you have here the exam in the left ear. This is air conduction is abnormal, is between 20 and 30, and anything below 20 from -10 to less than 20 is normal. So the bone conduction is normal, is almost zero. And there is a gap. It's called the air bone gap. So we have abnormal air conduction and normal bone conduction. What type of hearing loss? Mild conductive hearing loss. Why mild? Because the air conduction of the left ear is abnormal between 20 and 30. This is mild conductive hearing loss. But the bone conduction is normal. Bone conduction of left ear is normal. And there is air bone gap. So this is a case of mild conductive hearing loss. What is the reading of the tympanogram? It looks flat. Type B. Type B is flat with no peak. You can see in middle ear effusion, tympanic membrane perforation, patent ventilation tube. Visit lastminutepediatric.com to view most recent flashcard videos and courses covering all pediatrics. This is the end. Thank you.